I'm Megan.
I'm Rachel.
And this episode is about maintenance clients. Chloe Hart sent us a great question.
She did.
Which is the idea that loads of clients on a maintenance schedule, but sometimes you just fall into a rut and you want to know how to break that out.
Should we talk about maintenance clients?
Sure.
In the Jing method. So maintenance clients, in the Jing method, we basically advocate that if you've got a client with a pain problem, you would look at treating them once a week for up to 6 weeks, and you'd be expecting to get a reduction in that pain round about week 3. Once you get to a reduction in pain, then you would move your client onto once every 2 weeks, and eventually onto maintenance sessions. So I usually explain that to my clients and say I'd be looking to generally move you onto a maintenance schedule, as it's far easier to keep you out of pain than to
restart
fix you once you've got into pain again. And most people have had one chronic pain condition will get another. So you'll know this from your own practice. Someone comes with a frozen shoulder and a year later they're back with a low back pain. So what do we do with those clients that we see once a month?
So
ideas. Stop yourself getting bored.
So the idea is, right, you found something that works and you're doing it over and over again, and then you're like, ugh, I need something different. So the first thing that comes to mind for me is stretching.
Yeah.
I'm like, how do I do something different with this client? So I either stretch an area of the body in pain, or I focus on an area that isn't in pain. So for instance, if they've come with migraine pains and I've been doing all this neck and shoulder work, it's super exciting to like put in some leg stretches or really develop that. Or also to change modality form. So if you think, right, well, I always go in with a lot of fascial work and I always find great deep tissue work happens with trigger point. Actually, the next session, I'm just gonna spend doing a bit more AMA. The other idea, which also jumps to mind, is starting them in a different position.
Yes, a great idea.
Do you like that idea?
I do like it.
Okay, so if you're always going prone, then start them supine or side lying, and other stuff will flow. It'll come, and these are super simple ideas, but I think it makes a real difference in the treatment room.
Yeah, I love my maintenance clients because I think of my maintenance clients as a blank canvas for creativity.
Yeah.
So a great thing with maintenance clients is they're super fantastic people to try out all your new techniques on, because I know you're going on loads of courses, not just Jing courses but other courses, and so those people already know and trust you, right?
Yeah. And the other thing is to ask them.
Yes.
So there's also, I usually ask my clients, is there an area in your body that you really like having massaged that isn't in pain?
Yeah.
And I usually get feedback saying nobody's ever asked me that question. So I always have neck and shoulder stuff going on. And if somebody asked me that question, what I'd like worked on, my face. I love my face. So, but you might not get that, or somebody might just say, you know what, I love having my feet done or my hands done. And so sort of working with that too, and just using that as a go place.
Yeah. So a few quick ideas off the top of my head. You could try out some acupressure points. There's loads of acupressure points in the Jing book. You could definitely start in a different position. Do more work seated, is also good. You can get the client at the end of the treatment and you can do some stuff with the clothes on, neck stretches, things like that. Do more still work, People often feel that they're not able to incorporate more still work into their treatments. You could spend longer on some self-care suggestions, maybe teach them breathing techniques. There's like 20 odd different self-help resources on the Jing website. You could go retro and really crack out the Enya and some great old-fashioned relaxation, dancing around the table.
But really, I mean, reiterate asking them, because actually if you're working with a client over time, there might have been something along the way that you've done that they really like that you haven't repeated, and they'll love that, and they'll feel more empowered about their own healthcare, and they'll love you as a long-term therapist. So enjoy that.
Yeah.